And when we have inflammation present, it doesn't allow hormones to function as they normally would. Hey guys, Dr. Brad here. Now, I want to share a little secret with you that you probably already know, but I think it's important for us to talk about. And that is, your doctor does not care about your Hashimoto's. They should, but they don't. And I want to discuss today, one, why there's such a disconnect between Hashimoto's and the types of treatment and care that are provided to most people, and also why, even if your doctor isn't doing a good job of communicating to you, you need to know for your own purposes, for your own health, and that way you can chart a course that allows you to maximize your outcomes and feel your best. Now, we've talked before that hypothyroidism is just an umbrella term. It means that our thyroid isn't working properly. It means low thyroid function. And there can be a lot of different causes for hypothyroidism, and Hashimoto's is just one of them. Now, the reason why, whether it's Hashimoto's or anything else, we need to identify that cause, because depending on the cause, we're going to do different things. We want to match the treatment or the choices that we make to that underlying cause, and if we do so, we're going to have the best outcomes. And the way that I explain it to a lot of my patients is using symptoms. So if we think about something like fatigue, fatigue can come from a lot of different things. It's non-specific. We might have a thyroid problem that's causing our fatigue, or maybe we're chronically inflamed, or maybe we're anemic and we're not transporting oxygen properly. All of these issues can lead to fatigue and tiredness, but if we don't correctly identify what's causing that fatigue, then it's going to be silly if we choose something that entirely doesn't match with the problem. So if someone does have a thyroid issue that's leading to their fatigue, and they actually, or I should say, the person doesn't properly identify that, and they're given iron because iron's usually associated with anemia and low energy levels, then it's not going to work. And we want to put our effort into things that's actually going to have good outcomes for us and actually provide a benefit. Now, when it comes to Hashimoto's, it's really important that we understand how it develops and also what the progression looks like. Hashimoto's is an autoimmune condition, and that means that our immune system has made antibodies for enzymes and proteins within our thyroid gland. Now, normally, our immune system makes antibodies for different types of infections, and it helps us to fight those things off. But now, whenever there's a flare-up in our immune system, it is going to cause damage and inflammation to our thyroid gland, which can then impair our thyroid function. So at this point, you might be saying, great, I just have to make sure I get the right testing, which will be testing for TPO and TG antibodies on your blood labs. And if I do have Hashimoto's, then I just need to take the right kind of medication to help treat this condition. But here's where some of our issues come into play. Hashimoto's and the antibodies that go along with it develop many years before someone is officially diagnosed with hypothyroidism. So let me draw a little bit of contrast here. Hypothyroidism, or that low thyroid function that we talked about earlier, is defined by an increase in TSH and low T4. Meaning that we don't have enough thyroid hormone circulating our blood system, and therefore our brain, which manages a lot of that, senses that and tries to stimulate our thyroid gland to produce more by increasing TSH. But if these situations become chronic or the thyroid is damaged to the point where it just can't respond, then it doesn't matter what the brain does, even if the TSH is sky high, that T4 is still going to be low, and that's going to lead to low thyroid symptoms. And in this case, at this time, it would make sense that someone could take thyroid medication and hopefully it would help them to improve their symptoms. But this increase in TSH and low T4 is almost the end stage of Hashimoto's. Because those antibodies have already been active for years, it takes a long time for there to be enough damage for those lab values to actually change. But the question is, how are you as an individual feeling and functioning in that lead up to the point where you're prescribed medication? Most of the time, people feel just as bad before they're diagnosed with hypothyroidism as they do after they're diagnosed with hypothyroidism. But you might be wondering, why would you have symptoms in that lead up to hypothyroidism? If your TSH and T4 levels are still normal, shouldn't that be providing normal function to your cells? And the reason that it doesn't is because with autoimmunity and with Hashimoto's, because there is damage and irritation to the gland, just like if you were to sprain your ankle or injure any other tissue in the body, it creates inflammation. The damage that is occurring at the level of the thyroid leads to a systemic level of inflammation. And when we have inflammation present, it doesn't allow hormones to function as they normally would. So sure, you might have enough T4, and there isn't enough damage occurring to where that T4 level starts to drop. But even though the T4 is present, the inflammation then blocks our body's ability to bind it and actually stimulate our metabolism in a way that is effective and helpful to us. This is why for years, people will go into their doctor time and time again and say, I know I'm experiencing thyroid symptoms. And they will continue to tell you, hey, I'm looking at your labs, everything looks good. And they'll probably give you some whack answer like, you're getting old, or this is in your head, or something that is completely, totally bunk and doesn't reflect the necessary due diligence that's required to look into the situation and actually identify what's going wrong with your system and what's causing these symptoms. And honestly, you would hope as a human being, they would hear you and they do something, anything different to try and help you out, because these symptoms are real and no one should have to deal with them. So believe me when I say that I'm on your side with this stuff. So what I'm about to say is not a defense of them doing nothing, but the reason why I think a lot of these doctors don't care is because in their training, there is no difference to what is causing the hypothyroidism in terms of what we do or how we respond to it. Essentially, they're just looking for that change in TSH and T4. They don't care what causes it. And once those numbers change and the proper criteria is met, bang, that's when they can provide you the medication, and that's what all of their training is based around. But until we get to that point, unfortunately, most of the time, nothing is going to be done and no proactive steps will be taken. But this takes us to the second problem that a lot of people with Hashimoto's deal with, which is once enough damage has occurred, and once they have been diagnosed with hypothyroidism, and once they have been given medication, they still don't feel better. Sure, your fatigue might not be as bad, your hair loss might not be as bad, maybe you lost a few pounds, maybe not. But even when there are small improvements, that usually goes away after just a few months. Why is that? Well, it's the exact same reason that we talked about for why people have symptoms in the lead up to hypothyroidism. Hypothyroidism that is caused by Hashimoto's isn't purely a deficiency in T4. It's this complex web of autoimmunity and inflammation. And even if someone is being provided with medication that helps to normalize their TSH and T4, that inflammation is still present. And just like it blocked your body's ability to utilize thyroid hormone before, it's going to do the exact same thing now. Not to mention the fact that changes in thyroid function also leads to changes in digestive and gastrointestinal function, which, as that gets worse, makes things like our absorption of medication not as efficient as we'd like it to be. So if we're relying on getting our T4 levels up from our medication, and we're not really breaking things down like we'd like to, that's going to lead to additional problems where we can't get it into the system and we really can't use it very well. But even in these scenarios, your doctor still doesn't care about your Hashimoto's. You're going to go in, if the TSH is high, they're going to give you more medication. If your TSH is low, they're going to reduce your dosage. And if it looks fine, no changes will be made. And if your doctor is working and thinking maybe just a little bit, they might say something like, hey, I know you're still having symptoms, but if we can get your dosage nailed down, that's going to make a big difference for you. And right now, things are still fluctuating all over the place. But they never ask themselves, why is it fluctuating all over the place? And the reason for that comes back to Hashimoto's being an autoimmune condition. The activity level of our immune system is going to fluctuate. And when it flares up for someone with Hashimoto's, that's going to have more of an impact on their thyroid and therefore lead to worse thyroid symptoms. When their immune system calms down, they're going to feel a little bit better. And depending on the timing, depending on when we do our lab testing and catch that TSH, it might be on the way up, it might be on the way down. We really don't know unless we correlate it with how our immune system has been acting and functioning recently. So it's not as though these TSH changes are random, they're just responding to the increased damage that's occurring at our thyroid. And the truth is, you're never going to be able to figure out that right magical dose until we find a way to calm your immune system down, support it, and have it function in a healthier way. Truth be told, if every thyroid problem was just a deficiency in thyroid hormone, and all we had to do was give that person thyroid medication and things are fixed, then there wouldn't be any thyroid problems. But it's this lack of understanding of how the body works as a whole, and also treating everyone exactly the same when it comes to a simple change in TSH, that really impairs our ability to help people on a one-on-one basis. So even though your doctor doesn't care about Hashimoto's, and that led to you having to suffer with symptoms for years while they told you were crazy, and now you're suffering for years, not getting better because the only way they go after it is by giving thyroid medication to everyone, it's still something that's important for you to know and for you to understand. Why? Because autoimmunity, when it's not managed appropriately, progresses. And once someone is diagnosed with autoimmunity, our goal is not only to resolve and reduce symptoms, but it's also to reduce the progression of the condition. Again, some people need thyroid medication. There's nothing wrong with that, and you should play around with what the appropriate dosage is and what the appropriate combination of thyroid medication serves you the best. But thyroid medication, even in its best application, doesn't do anything to address the autoimmune aspect of Hashimoto's. It's only there to try to fill the gaps left over from the condition as it progressed in the first place. So if our doctor thinks that this is going to be the thing that fixes things, it's going to actually put us at risk. It's going to put us at risk to develop more sensitivities, less resiliency, less function, and potentially more autoimmune conditions. The environment that leads to autoimmunity, if not addressed, is maintained, and it increases the likelihood that other tissues become involved. And this is why we tend to see clustering of autoimmune conditions. So usually it's not just Hashimoto's, it's Hashimoto's and celiac disease. Or maybe it's psoriasis and rheumatoid arthritis, multiple sclerosis and Sjogren's. These are all autoimmune conditions, but the target tissue is different and it is named for the target tissue. But that's why we need to know about Hashimoto's in the first place, because we don't want to involve these other tissues if we can avoid it. And having the cause of your hypothyroidism be Hashimoto's is much different than someone who has a nutrient deficiency or an infection or a medication that's affecting our thyroid function. Those things can be resolved with the appropriate approach, but with autoimmunity, it's something we're going to need to manage for the long term. But today's video wasn't about diagnosing Hashimoto's, nor was it about different strategies that we can use to improve the condition. I have videos on all those things, and if you're interested, you can check them out. Instead, my main point is that you are right. Trust your body. You know what you're talking about when things aren't working properly and when they're different from what you've experienced for the rest of your life. And just because your doctor isn't up to date on the research and they're not aware that Hashimoto's can affect our body in these different ways, doesn't mean that you should be forced to suffer or be gaslit and told that what you're experiencing isn't real. Our thyroid problems are more complex than just a TSH and T4 marker. And if we don't assess the whole system, understand how it interacts, and apply a care plan that matches your body's needs, then sometimes it really can feel like we're going crazy. But that's not the case. And even though you shouldn't be responsible for your diagnosis and deciding what's best for your health, continue to do what you're doing. Learn more, advocate for yourself, because you deserve it, even if your doctor doesn't care about your Hashimoto's. Today's video was a little less technical than most of mine are, but there's still a bit of nuance in it. So if you have any questions about any of that or just Hashimoto's in general, let me know, leave me a comment down below. Also, if you feel like you're not being heard by your doctor and want to take a different approach to your health and are interested in working with me one-on-one, then you can send me an email at contact@seattlethyroidhelp.com. I'll also have that down in the description, and we can get you set up for a free consultation to see if we'd be a good fit to work together. If you'd rather make some changes on your own and do some things at home, you can check out my free downloads also in the description box or any of the other videos on the channel. And if you want to continue to see more content like this and keep learning about natural strategies to help you out with your Hashimoto's and your hypothyroid symptoms, remember to like this video, subscribe to the channel, and also ring the bell. But thanks you guys for sticking around, hanging out. Thanks for watching. Thanks for all the comments. I love you guys. I hope that you're doing well, and I hope that this information continues to benefit and support you and helps you to achieve your healthcare goals. If you'd like more information, you can follow me on Instagram or Facebook, where I post tips, strategies, and information almost every day. But my name is Dr. Brad Bodle. I hope you guys have a great rest of your week, and I will see you in the next one.